Hey, Darby, we can record and we're recording now as well. And I've got a question into our IT guy about recording on your end as well.
Okay, I appreciate it.
No worries.
Could you, if we're not able to record it on our end, send it our way afterwards?
Absolutely.
Thanks.
Kyle, this is Paul Miles. Can you hear me?
We can hear you, Paul. We can hear you.
Okay, because of my setup, I cannot ask questions on this mic when I'm recording. So can I type in any questions?
Yeah, just type them in the chat and I'll make sure they see them.
Thank you.
It looks like we're waiting on a few others here, if we can wait.
You let us just know when, Kyle. Thank you. It's out there. It's a
we can, if everyone keeps your mics muted until we're to the Q&A, we'll be good to go.
Thanks, Kyle. And thanks to all of you for joining us today. I'm John Walzak. I'm director of your Louisville Zoo. Our senior veterinarian, Zoli Giamesi, Dr. Giamesi, will be joining us today as well. And I'm going to be turning it over to him in just a minute, and then we'll open it up to any questions that you might have. Late last week, all three of our snow leopards, Kimti, Nisi, and Maru, were tested after exhibiting minor respiratory symptoms, including an occasional dry cough and wheeze. We immediately advanced precautions for the safety with everyone, for the cats and for the staff, and the cats are now off exhibit. Nisi tested positive for the SARS-CoV-2 virus, and we're awaiting results on the two male snow leopards. I want to emphasize their symptoms are mild and they're getting great care. A few reminders of the precautions that your zoo has taken since the onset of the pandemic last spring. Our keepers that work with animals that might be susceptible to the COVID virus have been wearing PPE the entire time. That includes keepers working with cats, non-human primates, bats, ferrets. They're always wearing the PPE. All of our staff undergo a testing every day. It includes temperature checks, a series of questions, and they know that if they aren't feeling well, that they're to stay home and take care of themselves and can report back to work after they're healthy. We continue to take these precautions and do everything that we can to keep our guests and animals safe. I want to thank all the institutions that have helped us through this. This has been a very involved process with the diagnostics and working with all of the consulting institutions. I also really want to thank our keeper team, our animal care staff, and our animal health care staff for making these observations very early. They did a great job in picking up on these mild symptoms early on, and their care has been excellent. At this point, I'm going to turn it over to Dr. Giamesi, and he's going to give you more details about the cats. And from there, we'll open it up to any questions you might have. Zoli?
Hey, thanks, John. Hopefully everybody can hear me. So I'm Dr. Zoli Giamesi. I'm the senior staff veterinarian here at the zoo. So for about the last 2 weeks, all three of our snow leopards have been exhibiting very mild, very intermittent clinical signs, respiratory symptoms, consistent with a dry cough or wheeze. No cats are lethargic, no cats are inappetent, so it's really just very mild signs. And we elected to test them for SARS-CoV-2 for a few reasons. One, of course, COVID is surging in the country and in our city. We're starting to see some zoo staff be affected by this, both those that work with animals and those that don't, either being out sick for a period or being out because of some exposure. And then the third reason we elected to test was we know that based on reports from New York City in the spring and a zoo in Tennessee in the fall, and then as recently as this week, a zoo in Spain, we know that some of these large cats up till now, lions and tigers, are very susceptible to this virus, so highly transmissible. So in order for a veterinarian to test an animal, you have to get approval by the state veterinarian and state public health veterinarian. And indiscriminate testing of animals is not approved or encouraged, but in this case, permission was granted. We sent out fecal samples late last week, to the University of Illinois, so a regional laboratory for testing. We elected to screen the cats via fecal sampling because it's non-invasive. And because the cats have such mild symptoms, we didn't feel like anesthesia was warranted to collect samples from their nasal cavities or from their lungs. So we sent out fecal samples. Presumptive positive tests from the University of Illinois were passed on to the federal animal testing laboratory in Ames, Iowa, the NVSL, or National Veterinary Services Laboratories. And from there, we learned that Nisi, a 5-year-old female, is confirmed positive for SARS-CoV-2, the same virus that causes COVID-19 in humans. The other two cats, Maru and Kimti, we're still awaiting results. That's going to take some more genetic testing that could take a few more days or up to 2 weeks to get those results. So we're still waiting on confirmation of the other two cats. We have one case confirmed. This is the first case confirmed in a snow leopard. So it's a new species. But, to us, not shocking because, snow leopards are the same genus, Panthera, as lions and tigers. So it makes sense that the virus could affect them similarly. This isn't the first case in an animal in the state of Kentucky. There was a cat, a household cat, diagnosed back in September. So it does happen from time to time. We presume that Nisi was infected by an asymptomatic a staff member. That's the way this usually works. It's typically a human-to-human transmission disease that occasionally spills over into people. Or excuse me, let me say that again. It's a human-to-human transmission disease that occasionally spills over into animals. So that's how animals typically get infected, is from being in close contact with a human with COVID-19. Probably a human that doesn't even know they have it in some cases. No other animals at the zoo are infected at this time. Obviously the animals are watched very closely and monitored, and there's no other animals in the zoo that we know of at this time that have clinical signs. All 3 snow leopards will be off exhibit for the time being while we monitor Nisi and await for confirmatory results on the 2 males. With the uptick of clinical signs last week, we talked to our staff that care for the snow leopards. And as John mentioned, they've been wearing masks since April, but we enhanced the PPE to include face shields, disposable coveralls, and boot covers and gloves since we started to have cats that were showing some symptoms. That said, the risks of a human acquiring it from an animal, an infected animal, is pretty low. So that's not the way it typically works. Typically it goes the other way from a sick human to an animal. So we're not highly concerned that the cats are going to pass it on to people. John, do you have anything else to add? Should we open it up?
Thanks, Oli. I appreciate that. I just want to add in general about the zoo. Since we've opened last June, I can't tell you how wonderful it's been, how many guests that I've encountered at the park that are just thanking us for being open and providing this great resource and a safe environment for everybody to enjoy. And the steps that we've taken to make sure that we are doing everything possible to maintain the very best public health. And we've worked with Louisville Metro Department of Public Health and Wellness to make sure we're following the latest in safety guidelines. Since last spring, we have signage around the park reminding people to social distance, and we have PA announcements reminding folks to social distance. Masks are required for everyone over the age of 5 when folks enter the zoo and whenever they're in places where they cannot social distance. And we encourage people to wear masks all the time as they go through the park. We've been disinfecting high-touch areas. If you've been to the zoo, we've had attendants stationed throughout the park with carts with wipes and sanitizing disinfectant, making sure that everything is clean. And all staff wear masks. All of our staff will wear masks, certainly when they're out in the public areas. You've probably seen them doing so. We've added automatic doors. We've added step-in pools for those that didn't have automatic doors for places like restrooms when people need to utilize those facilities, which are pretty much our only indoor facilities, which are open here at the park. And I want to reemphasize our concern, of course, is for the guests, for the staff, and the animals. And our staff go through daily health screening, which includes a temperature checks, a series of questions, and they're doing a great job in monitoring themselves and making sure they're doing everything to take care of the animals, their coworkers, and the guests. We'll have a list of frequently asked questions and responses at louisvillezoo.org/together. That's louisvillezoo.org/together. And now Dr. Zoli and I are here to take any of your questions. Kyle, did you have something you wanted to add?
I do want to add that's actually louisvillezoo.org/catcare is the best link for the FAQs on our website /catcare, louisvillezoo.org/catcare. And we've got a couple of questions coming in. I'll go ahead and get those. Paul Miles from 84 WHS Radio. Is this the first COVID case involving an animal at the zoo?
The answer to that is as far as I know, yes. Dr. Zoli?
Yeah, this is the first case that we've honestly, the first case we've tested and the first case that's documented, yes.
Second question from Paul Miles, also from 84 WHS. Can humans contract the virus from animals?
Yeah, so that's theoretically possible. So infected animals do shed live virus in their feces and their respiratory secretions, so that's why we take precautions. But it's very, very rare. So there has never been a confirmed case of spread from a infected lion, tiger, dog, cat back to a human. The only case where this virus has gone back to people is in some of these mink farms that you guys have probably heard of. But that's a unique situation where you have animals packed in pretty tight quarters. And in that case, I believe the virus mutated and caused some issues with people. That's why they're doing mass euthanasia with mink in Europe and elsewhere. So that's the only case where it's back to people.
Ben Tobin with the Courier Journal, Dr. Jamesi, along with enhanced PPE, have there been any other additional precautions put into place for staff caring for cats?
Yeah, John mentioned some of that, not working sick and washing your hands and wearing the PPE. But in addition, distancing is real, right? So our staff has backed off on some of the training that we typically do and are real conscious of how close we are to not only the cats, but apes and monkeys and other species that we know are susceptible.
Some of those additional PPE items too are face shields. We have foot baths. So when staff cross from one area to another, they'll step through these disinfecting foot baths. So our animal health care team is taking every precaution with the PPE and doing everything that they can in terms of protective cover.
Paul Miles, 84 WHS Radio. Do you plan to pause any public admission to the zoo because of this case?
No, as Dr. Giamesi stated, and I think I also stated as well, that the snow leopards are off exhibit, but we're going to remain open. The zoo is safe. We've got great precautions in place, and this is a very specific and isolated situation.
Laura Ellis, Louisville Public Radio. Do we know which other animals can catch COVID?
Well, there's been cases in some of the big cats, as we talked about, lions, tigers, not snow leopards. There's been cases in dogs and cats. There's been cases in mink. But we're learning more and more every day about this virus. So, if you look into the literature, there's cases in the lab setting where they actually challenge different species with virus, but that's, of course, different than the real world. So those species I mentioned were kind of the top species that we know of.
Darby, WDRB, do we plan on testing other animals, and should people be concerned about passing COVID along to their pets?
Yeah, so we'll consider further testing of animals if they're symptomatic. We're probably not going to do widespread testing. I'm not sure that would even get approved by our state veterinarian and state public health veterinarian to do that. And as far as pets, yes, the CDC has a great link. I think that's in our press release of precautions that humans with COVID that are isolating at home, precautions they should take with their own personal pets. Because, yeah, it's potential to spread it to your dog or cat.
Anyone else have any additional questions?
And I think John mentioned this. I just want to reiterate that this disease in these cats is not life-threatening. It's not believed to be extremely severe. So we fully expect all three cats to rally and recover, and we'll be following, we'll be testing their feces on a regular basis to see when they cease viral shedding.
Laura Ellis with a follow-up question. Any idea how long they will be feeling bad?
Well, the fact that they're not lethargic and they don't miss a meal tells us they don't feel too badly. But the news from the New York City Zoo that had cases in lions and tigers, some of their cats shed virus for up to 35 days. Other zoo information tells us about 2 weeks. So we're going to just follow it out and see how it goes, and they'll be off exhibit until they're.
Our staff does a great job in monitoring the health of our animals. The best example I can give would be like having a parent that's a nurse that spends 9 hours a day with you. Our keepers are acutely aware of the animal's slightest signs, just like noticing the cough that they did with these snow leopards. Dr. Zimasi just mentioned they're eating, they're eliminating, they're not lethargic. And our team does a great job noticing the slightest least change, which has led to the early diagnosis and our response to taking care of the snow leopards. And that exists throughout the entire park and with all of the animals.
Paul Miles, 84 WHS Radio. Is a vaccine for animals in the future?
That may be on the horizon. I'm not sure about that. That may be coming though at some point after the human vaccine comes out.
Anyone else? Wait a few seconds here.
Sure. Kyle, I'd just like to remind everyone, and I know I did this a minute earlier, but we continue all of our precautions so the guests have a wonderful, safe experience. Our teams are out there helping the guests stay safe, making sure that people are social distancing, wearing their masks, and it's a great experience to come on out and enjoy the animals. The zoo is a wonderful place to kind of get away from the stresses that we've been going through for the last 9 months, get some fresh air, and enjoy these amazing creatures out here at our zoo.
Doesn't look like there's any more questions yet. So you guys have an image of Nisi. I don't have any video right now. I'm sorry about that. If there's anything else I can provide you with throughout the day, feel free to call me. You've got the number 502-744-5639. And then don't forget the FAQs at louisvillezoo.org/catscare. And of course, our website as well. And we've recorded this, so I will send this right away to all of you here in a few seconds. I think we're good.
Thank you all.
Thank you.